It's really disappointing that we scored so badly, but unfortunately not shocking. And I think what it shows is a real reflection of our lack of numbers in front care staff. So we have a very low number of neurologists per patient population, and that's one of our biggest problems, because in order obviously to get proper diagnosis and care plans, you have to go through a consultant. So I think what it means for patients, unfortunately, is that they have these crazy long waits for diagnosis and scanning and diagnostics. And that's really frustrating, because often, say in the community, a GP would be sure someone has something, but it has to be diagnosed. And then obviously to access the care that they need, they have to go through the hospital system.
I would say that the score in the index certainly reflects how the situation currently is in Ireland, and would be indicative of my experience of interacting with the Irish healthcare system. While we do have a good public healthcare system, and we're very lucky to have it, it's chronically understaffed and under-resourced, and that really kind of shines through in the standard of care you can get, just in relation to things like access to neurologists at your appointments, which are only once or twice a year. And these clinic appointments would maybe be like 15 minutes. So it's just getting access to people and getting to talk to somebody who is an expert in your condition is kind of, I would say, lacking.
Ireland's performance in the MS index was quite poor. Now, that's not surprising to us, because there is a real chronic lack of specialist services and healthcare specialists. We know that we have 2 neurologists per 100,000 people, and that's very similar to the UK and the worst in the 30 countries. Also, we know that we don't have any neurorehabilitation centre, and we don't have the services that we need for people with MS. The other thing that we quite clearly found with the MS index was there isn't enough national or data available to us, or European data available to us, and that's because we don't have any MS registry. We really need to have an MS registry so that it's clear that we understand what are the services and needs of people with multiple sclerosis.
I'm not at all surprised with Ireland's score in the index. It's most disappointing. It's shameful, really, if I'm quite honest with you. We need more assistance. We really and truly do. And it's about time future-proofing was undertaken by the healthcare system in a more productive way.